I'm going to start with a little video I just came across a couple of years ago, if it works.
See you again. Cheers. Anything else? Excuse me, madam. This might do the trick.
Oh.
At Caltex, our staff will do whatever they can
Thank you so much.
You're welcome.
to help make your life a little easier. Caltex, nice and easy.
So let's talk about tribology for hips. You know, I come from Munich. The famous FC Bayern plays in the Allianz Arena. Although they're not playing really well right now, they finally won a game yesterday, but the malpractice might be a topic for the newspapers, not a topic for this conference. But why do I say that? Because those guys usually truly use their joints. And that's a guy I just did last week, 43 years old, bilateral hip, professional sports player. Used the Tribology stem because I wanted to survive. And our challenge are the young active patients, and they do have a higher tribological demand. And we know the revision rate is a little different for this group of patients. But if you look at the revisions, loosening, and that's out of the German arthroplasty register, loosening is still one of the top causes of revisions. And why do we have that? Because of wear. And I don't have to explain you how wear works and leads to osteolysis. You guys all know that. But we want a long survivorship, and we want a perfect function. And how we usually increase the function in hips is with head size. We get a better range of motion and stability. And we know data that showed that the 36 millimeter head has a higher wear compared to the smaller things, but that's for metal heads on poly. That's not true for the ceramic heads. And with the metal heads, especially for the 36 millimeter heads, we had the problem with trunionosis, and we had to revise many stems because of a severe damage on the taper. If we look at the German arthroplasty register again, we see that we really try to use 36 or 32. Probably the 28 millimeters are just the really small cups. We compare wear with the different materials, different bearings. We know that metal on poly has the highest wear, while ceramic on ceramic has definitely less wear. And again, German arthroplasty register data from the last year, we see that our standard in Germany is ceramic on highly cross-linked PE, and the metal heads almost disappeared. But that's not true for the other countries. There's a real global diversity on that topic. If you look into the Scandinavian countries, they do lots of metal on poly. And if you look at Australia or South Korea, there's a lot of ceramic and ceramic, and it even made it into a commercial. If you look at revision rates in the different registries, metal on poly, metal on metal have the highest rates of revision, while the others are almost the same. So if we look at ceramic on ceramic, it has the lowest wear of all. It has excellent chemical stability, excellent lubrication, high biocompatibility, and you don't have any problems with the larger heads. But you do have the squeaking, and it really appears. You have impingement, and although rare, we do have fractures of head and liners, and of course it's more expensive, and that might be the main reason why Germany doesn't have those high numbers. Reasons for noises, it's multifactorial. It might be malpositioning, impingement, high BMI, or even leg shortening. But if you compare the different bearings, and this is a study out of the German Journal of Arthroplasty, compared ceramic on ceramic and ceramic on polyethylene. There was no difference in survivorship, and I'm going to show you a different study here. 100 patients, 200 hips, so bilateral hips, and one side was done ceramic on ceramic, and the other side was done ceramic on poly. And the data showed no difference, with a long follow-up of 12 years, no difference in clinical and radiographic results. So why do it more complex if you can get the same results cheaper and easier? If you look at other options, for example, for the Pinnacle Cup, there's the Ultrax polyethylene, where they just used a different dose for the irradiation, and they could achieve a lower wear, almost compared to ceramic, so ceramic by 50%, but again, higher costs. So although we've come a long way, we're still not done. We still have loosening, threatening, trunionosis, wear, infection, and there's a true need for innovation and further investigations. Maybe nanotechnology might come up with different materials. Biomimicry in terms of lubrication is a really important field. And what if we can finally coat our implants, for example, with an antibiotic to prevent infection? Thank you.
Thank you very much for this very nice